we prevent cervical cancer from developing? The answer is yes. Hello everyone. We have discussed about cervical cancer, its risk factors, signs and symptoms, etc. in our previous video. Now in this video, we shall be talking about how can we prevent cervical cancer. The two primary screening tests for cervical cancer are Pap test and HPV tests. In this video, we shall be discussing in depth about both these screening tests. There is a common confusion as to which screening test to opt, whether the Pap test or the HPV test. Let us try to unfold the mystery so that we can get a better understanding. We must know that effective cervical cancer screening allows doctors to detect the disease before it grows and spreads to other areas. Before delving deep into the topic, let us quickly go through the basics of cervical cancer. Most of the cervical cancers are caused by human papilloma virus, which is a sexually transmitted infection. We had discussed that it is very likely to get infected with human papilloma virus at some point of our life if we are sexually active. But our body is very much capable of eliminating the virus in a couple of years, and most of the people do not even get any symptoms related to it. Even though cervical cancer is one of the most commonly encountered gynecological cancer in our country, it is important to remember that it is also the most preventable cancer with regular screening. When we take a worldwide statistics, cervical cancer is the third or fourth commonly encountered cancer, and that is primarily due to the utilization of these screening techniques. Early detection of cell changes can definitely help us in effectively eradicating the possibility of development of cervical cancer. Now let us go through these screening tests in detail. First we have is pap smear. So pap smear is a procedure in which a small brush is used to gently remove cells from the surface of the cervix and the area around it so that it can be checked under a microscope for cervical cancer or precancerous cell changes that may lead to cervical cancer. Precancers are cell changes that can be caused by the human papilloma virus. Now, if not treated, these abnormal cells could lead to cervical cancer. A pap smear may also help find other conditions such as infections or inflammation. During a pap test, now how is a pap test performed? During a pap test, your doctor or nurse puts in a speculum. Speculum is a tool that helps your doctor or nurse to see your cervix. Now, this speculum is inserted into the vagina and they use a special stick or a soft brush, okay, to collect the cells from outside of your cervix. Now, these cells are then sent to a laboratory for testing. Generally, we advise that pap smears are supposed to be repeated once in every 3 years. That highly depends upon what your previous pap smear results have been and also on the general history, the family history and general history, medical condition of the patient. Now let us talk about the HPV test. An HPV test looks for DNA from human papilloma virus in cells from the cervix. Now when we compare it with pap smear, pap smear screened or allowed us to identify any kind of abnormal or precancerous cells. Basically, it showed the cellular changes in the cervix. What HPV test shows, it shows the strain, which type of human papilloma virus is present in the cervical cells that is bringing about these abnormal cellular changes. Okay, so pap smear helps us to identify if any cellular changes are present, and HPV test helps us to identify which type of human papilloma virus is causing these changes. Okay, the sample collection technique is same as that of pap smear. That is, a speculum is inserted into the vagina and followed by collection of the sample with a soft brush. Okay, an HPV test can provide additional information about the cells from the cervix. For example, if pap test shows abnormal cervical cells, HPV test can show whether you have a type of human papilloma virus that can cause cervical cancer. Now, we have already discussed that there are more than 150 strains or types of human papilloma virus in our previous video, right? Among which type 16 and type 18 are highly carcinogenic, or these types are known to cause um, cervical cancer. So, if the pap smear shows any kind of precancerous cell changes or any kind of abnormal cell changes, we can go ahead with the HPV test so that it can help us identify that which type of human papilloma virus or the DNA of which type of human papilloma virus is present in the cells of the cervix, so that we can identify the risk that the patient is in, what risk category the patient is in. All right. Now, HPV test is advised to be repeated once in every 5 years, and it is more sensitive and accurate as compared to pap smear. It is more sensitive and an accurate test as it directly shows which strain of human papilloma virus is present in the cells of the cervix. Again, reiterating what we discussed in our previous video, it does not mean that even if you are infected with type 16 and type 18, the carcinogenic types of human papilloma virus, it is not mandatory that you are going to develop cervical cancer. If the body's immune system is at an optimal level, it can definitely uh, remove, or it can definitely uh, you know help eradicate the virus from the body very effectively. Now, who should get tested for cervical cancer? A general recommendation is that women from age 21 to 65 years should get themselves screened for cervical cancer, in which pap smear is recommended once in every 3 years and HPV testing is recommended once in every 5 years. PAP and HPV can be done together, and this is called as co-testing. Now, this 3 years and 5 years span is applicable only if the previously done screening reports are normal. So, if any abnormality is found in the previous reports, or if you have a family history of cervical cancer or a medical history that is prompting your doctor to suspect you for cervical cancer, your doctor may advise you to get tested more frequently, and that is highly case specific. Now, who should not get, or who does not need to get tested for cervical cancer? Women above 65 years of age with three normal pap tests or two normal co-tests in the last 10 years. So we have seen about co-testing, that is pap smear and HPV test done together. So if a woman has had two normal co-testing done or three normal pap tests in the last 10 years, she might not need to continue with cervical cancer screening test. Next is women who have undergone a surgical removal of the cervix along with hysterectomy. So, if she has undergone a hysterectomy along with surgical removal of cervix, she does not have a risk of developing cervical cancer. So, she does not need to get herself screened for cervical cancer. So stay tuned, everyone, as we will be continuing with the discussion of abnormal uterine bleeding in our upcoming videos. Do consider to like, share, and subscribe to the channel if this information was useful to you, and follow me on Instagram for more such helpful health related topics. Thank you.